Good day, everyone. I'm going through a course on bladder and bowel dysfunction at this moment in time, and it fascinates me. In chiropractic, we're very interested in normal function and abnormal function and how they relate. And when we talk about bladder and bowel dysfunction, it's very intimately related to the function of the pelvis. And as a chiropractor, I just put my hand up and say, wow, I'm interested in how the pelvis functions because it is the root of the spine. So there are a lot of the dysfunctions that are structural and will need to be going to a specialist of some sort to check it out. But what we've seen is quite a few of these dysfunctions are related to what happens in the mechanisms of movement in the pelvis. And therefore chiropractic and physiotherapy are really good at helping this out. I know this topic might be a bit tough for some people because the pelvis, the bladder, the bowel, not necessarily something that you talk about all the time. But I know for a lot of people, they're influenced on a daily basis because of the issues in their pelvic floor. So what I want you to do is next time you go and urinate, just be aware of a few things. Number one, I want you to be aware of the flow of urine. When you start to urinate, you should push into a peak, bell-shaped curve, and then come down. It should be relatively smooth, and you should be able to have that force, and then it should drop off. When you end, you should end. There should be no stop, start, stop, start, stop, start, and it should be a continuous stream. Number two is you should feel that your bladder is contracting, the muscle of the bladder is contracting to initiate the pressure of urine coming out. You shouldn't feel that your abdominal muscles are having to do a hell of a lot of work. In actual fact, they shouldn't be doing any work at all. You should feel the neck of the bladder release, and that allows the urine to start. And that's your first connaping mechanism. The second connaping mechanism is your pelvic floor. And you should be able to release your pelvic floor, allowing the flow of urine. You should be able to contract your pelvic floor and hold the flow of urine. You want to look at whether you have urgency and can you control the urgency. You want to have a look at how easy or how difficult it is to initiate the flow of urination. And you want to look at the power of your flow. Please, if you have any challenges, let me know and we can direct you positively. Have a wonderful day. Remember, awareness leads to corrective action.